When it comes to providing care in the East End, Dr. Mayurendra Ravichandran has spent most of his medical career doing that. As time goes on, it gets harder to do within the current ER.
This is a challenge that many hospitals face, but I think Scarborough and Birchmount especially, there hasn't been much change to the infrastructure in years.
CityNews toured Birchmount. Finding an empty room like this to get footage wasn't easy. The ICU, medicine, and emergency units each only had 1 or 2 vacancies. The ER sees around 55,000 visits a year. It's built to only service a third of that volume.
We've provided a lot of great care to our patients in maybe facilities that aren't the standard that we should expect.
Issues can extend beyond the building. Scarborough's growing diverse population has faced limited care access.
It's for many reasons, but when we see them, sometimes they're sicker and they really need our support. It is a challenge sometimes, and we have a lot of approaches. A lot of our healthcare workers speak the language of our community, and that helps a lot.
If the Birchmount Hospital wasn't here, we would be underserviced in a very major way.
Scarborough Health Network head David Graham says there's a 10-year plan for change, starting with the new Bridletown Centre in Lamoureux. It will be the future home for dialysis and chronic disease prevention programs. Now back on Birchmount Road.
What you're going to see is a brand new podium as well as a patient tower, and it's going to be located on the south end of our building, and it's going to rise up into the sky.
The hospital, which has 850,000 people in its catchment area, will double in capacity in the end. A noticeably bigger ER, and more than 200 inpatient beds, along with...
There's going to be brand new 14 new operating theaters. There's going to be labs and diagnostic services.
As planning continues, Ravichandran has this hope for a decade from now.
I'm looking forward to being able to look back and say that, you know what, we've kind of met the needs of the community.
So the province has approved the expansion, but Scarborough Health Network needs to contribute. SHN's Charitable Foundation has launched the Love Scarborough campaign, you may have seen signs for that, to raise money for equipment and part of the building costs.